So you've had a lot of training with fixing people's bites with TMJ problems. Tell me about that.
TMJ, it's also called TMD because it has to do with the temporomandibular joint and how it doesn't function properly,
Okay.
leads to a lot of problems.
How do you know if you have it, by the way, a TMJ or TMD problem?
Well, the problem with that is TMD mimics a lot of other problems. So a lot of people who think they have migraine headaches actually have TMD problems and vice versa. So what we want to do is evaluate a patient to see if headaches that they're having or jaw pain that they're having or neck pain that they're having is related to their bite problems. And what is going on is that the teeth have either worn down or not in the correct position, so that when you bite down it strains the muscles of the head, the neck, and the face. So you can have severe pain, you can have migraine-like symptoms. There's a myriad of issues that appear to be temporomandibular joint related.
Have you fixed people's mouths?
I've fixed many people's mouths, and I've had mine fixed too. I was having so much pain several years ago that I was thinking about quitting dentistry. I mean, I could not.
What, headaches or what? Or sore jaw?
I had a stiff neck. I could turn my head about like that. And I was sitting at a meeting where they started talking about bite problems, and I thought, of course I've got TMJ problems.
Okay.
So one of my friends, I asked him to evaluate me, and he made me an appliance. Went to bed, woke up the next morning, no stiff neck for the first time in over a year and a half. Before that, I'd been to see orthopedic surgeons, and they had told me they could fuse my neck. They didn't want to do that because that would permanently fix my neck from moving very much. But it saved my life.
Okay, so because your teeth didn't come together right.
My teeth were worn off and overclosed.
So when you're sleeping, what? It's
I was
a lot of...
I was probably grinding and clenching my teeth. But it's not just when you're sleeping. It's all day long.
All day long.
It's all day long. And after a while, something
But you didn't
has to
know
give.
you were doing this?
No, I didn't know I was doing that.
Okay, interesting.
But it goes on all day long, and something somewhere will give way. It can be the teeth, it can be the gums, it can be head and neck pain. It can be any of those things.
So when you fix the way the teeth come together, the symptoms like migraines, stiff neck, go away.
That is correct.
Is that right?
Yeah. But it's real important to be evaluated to make sure that it is TM joint related, because like I said, these problems mimic each other. So a lot of times if you've been to physicians and they aren't helping you, get evaluated for TM joint problems, because that may be where the source of your pain is.